Good morning. Today we are going to discuss about biomechanical principles of tooth preparation in fixed partial denture. I am Dr. Arya Sukumaran, Senior Lecturer from the Department of Prosthodontics. The main objective of a tooth preparation is to create space for the restoration. That is, in order to receive a restoration, the tooth requires sufficient reduction. For a restoration or a prosthesis which we are giving to be successful, we should follow certain principles. These are called as fundamental principles. As you can see in this video, there is a sequence for tooth preparation and different types of burrs are used for tooth preparation. We know that there are different types of restorations. That is, metal is there, metal ceramic is there, all ceramic is there. And for each of this restoration, tooth preparation is also different. That is, marginal preparation is different, amount of tooth reduction is different. So obviously the burrs used also will be different. So we should know about the principles to be followed for a good tooth preparation. Today we are going to discuss about the principles of tooth preparation. Before that, what is a tooth preparation? According to GPT-9, it is the process of removal of diseased or healthy enamel and dentine and cementum to shape a tooth to receive a restoration. And Tillman has defined it as the mechanical treatment of dental disease or injury to hard tissues that restores a tooth to original form. These are the definitions of tooth preparation. Now, what are the objectives of tooth preparation? According to Tillman, he has given 4 objectives of tooth preparation. First is reduction of tooth in miniature to provide retainer support. Second is preservation of healthy tooth structure to secure resistance form. Third, provision of acceptable finish lines. Fourth, performing pragmatic axial tooth reduction to encourage favorable tissue response. These are the objectives of tooth preparation according to Tillman. Now, what are the principles of tooth preparation? There are 5 principles according to Schillingberg: preservation of tooth structure, retention and resistance, structural durability, marginal integrity, and preservation of periodontium. These are the 5 principles which is given in Schillingberg. Now, according to Rosenstiel, the principles are divided into 3, that is biologic, mechanical, and aesthetic. Biologic principle, it will affect the health of oral tissues. It is dealing with the health of oral tissues, which includes conservation of tooth structure, avoid over contouring, providing supragingival margin, providing harmonious occlusion, and protection against tooth fracture. And mechanical principles is dealing with the integrity and durability of the restoration, which includes providing a proper retention form, a proper resistance form, and prevention of deformation. Now, aesthetic principles, it affects the aesthetics or appearance of the patient. It includes minimum display of metal, maximum thickness of porcelain, porcelain occlusal surface, and subgingival margin. These are the principles according to Rosenstiel. Now we will see each of these principles in detail. First is biologic principles or biologic considerations. It includes prevention of damage during tooth preparation, conservation of tooth structure, considerations affecting future dental health. Prevention of damage during tooth preparation. Damage, it could be a hard tissue damage or a soft tissue damage. How can we prevent damage to the adjacent tooth? What if a damage occurs to the adjacent tooth? There will be a chance for caries. That is, the tooth will become more prone to caries. So we should prevent it By placing a matrix band, we can prevent it. That is, during tooth preparation, a matrix band can be kept on the proximal surface to reduce unnecessary preparation of the adjacent tooth. So what if we are using a thin matrix band? There is a chance of perforation of the matrix band, thereby causing damage to the adjacent tooth. So clinically, what we can do is to provide a clip of enamel. That is, a thin tapered diamond burr can be used, can be passed through the interproximal contact area by leaving a slight lip or fin of enamel without resulting in excessive tooth reduction. Like this, we can prevent the damage to the adjacent tooth. And this fin of enamel or a lip of enamel can be cut off with the help of a hand instrument. Next is prevention of soft tissue damage. It can be prevented by using aspirated tip, mouth mirror, flanged saliva ejector. This type of cheek retraction and tongue retraction. Using this type of instruments can be done to prevent soft tissue damage. And prevention of protecting the gingival margin can be done by placing retraction cord before tooth preparation. Now, prevention of damage to pulp. There are various reasons for pulpal injury. That is, temperature could be one reason, chemical irritation, and bacterial action. Extreme temperature, chemical irritation, or microorganisms can cause irreversible pulpitis, particularly when they occur on freshly cut dentine. Temperature. Excessive temperature can be prevented by various ways. That is, do not use excessive pressure. Always do a feather-like touch with burrs on tooth. And higher rotational speed should be given. And cutting instruments which we are using should be sharp, because if the cutting instrument is not sharp, it will cause less efficiency and more heat generation. So if burr is sharp, there will be less heat production. And always use coolants, because heat should not be raised more than 46 degrees. If it is more than that, there will be a chance of pulpal damage. So air water spray, always we should use air water spray to prevent heat buildup, prevents clogging, for improving visibility and cutting efficiency. Next is chemical action. That is, chemical action of certain dental materials can cause pulpal damage. You know, there are various luting agents, various cements are there, and all are having separate properties. How can you prevent this damage? We can use a dentine bonding agent, but the problem is the use of dentine bonding agent is controversial. That is, dentine bonding agents form an effective barrier in most cases, but their effect on retention of cemented restoration is controversial. Bacterial action. All caries dentine must be removed before placement of a restoration. Always remember this. There should not be any caries dentine. And indirect pulp capping, they are contraindicated because there might be a chance of failure at later stage, which will put us into a situation of redoing this expensive treatment. So always avoid indirect pulp capping before we are going for a fixed prosthesis. And always take a preoperative radiograph before starting the procedure, and pulp vitality test. If you are doubtful about the vitality, you can go for a pulp vitality test. That's all about the prevention of damage to tooth and soft tissue. Next is conservation of tooth structure. So there are certain guidelines to be followed to conserve the tooth structure. First is use of partial coverage restoration rather than complete coverage restoration. Obviously, partial coverage restoration will have less amount of tooth preparation than complete coverage restoration. Second guideline is preparation of teeth with minimum practical convergence between axial walls, that is minimum taper. What is a taper? Taper is the convergence of two opposing external walls of a tooth preparation as viewed in a given plane. That is, if there is excessive taper, it will result in considerable loss of tooth structure. So there should be a minimum taper between the axial walls. Third principle is occlusal surface reduction should follow the anatomic planes. That is, it should follow the cuspal planes. It should not be flat. Fourth is selection of a conservative margin compatible with other principles of tooth preparation. There are different types of margins, which we will discuss later, but always use a conservative margin for reducing the amount of tooth structure. But we cannot always stick on to this principle because sufficient amount of tooth structure should be reduced to satisfy other mechanical principles. So, the next point is avoidance of unnecessary apical extension of the preparation. Next is preparation of axial surface such that maximum thickness of the tooth structure is retained. So these are the guidelines for conservation of tooth structure, that is use of partial coverage restoration, then complete coverage restoration, preparation of teeth with minimal taper, occlusal surface reduction should follow the anatomic plane, selection of conservative margin, avoidance of unnecessary apical extension of the preparation, and preparation of axial surfaces such that maximum thickness of the tooth structure is retained. Next is considerations affecting future dental health. It includes axial reduction and occlusal consideration. Axial reduction. The successful preparation should provide sufficient space for the development of anatomically correct axial contours. That is, crown should duplicate contours and profile of the original tooth. Also, it should be same as that of the adjacent tooth. The contours should be same as that of the adjacent tooth. And we should avoid over contouring. Sometimes if you are preparing the tooth in a minimum amount, there is a chance of over contoured restoration. What happens if over contouring is there? There will be a chance of plaque accumulation, or the patient will not be able to maintain effective plaque control. So avoiding over contouring is important. Margin placement. Whenever possible, the margin of the preparation should be supragingival. What is supragingival? Supragingival margin is coronal to the gingival crest. Equigingival margin is at the level of gingival crest, and subgingival margin is apical to the pregingival margin. What are the advantages of supragingival margin? They can be easily finished. They are more easily kept clean. Impressions are more easily made. Less potential to soft tissue damage. And restoration can be easily evaluated at recall appointments. Now, where is subgingival margin indicated? In case of caries, erosion, or restoration extending subgingivally, or if there is additional retention is desired. In case of short clinical crowns, and for aesthetic purpose, if root sensitivity is there, and if modification of axial contour is indicated. Now, marginal adaptation. The junction between a cemented restoration and the tooth is always a potential site for recurrent caries because of dissolution of fluting agent and inherent interface roughness. So a good preparation should have a smooth and even margin, and a good marginal adaptation is important to prevent recurrent caries. Next is margin geometry. There are different types of margins. Are there? Actually, these are called as finish lines. There are different types of finish lines are there, which includes feather edge, knife edge, feather edge or knife edge, chisel edge, bevel, shoulder, chamfer, slope shoulder, shoulder with bevel. These are the different types of finish lines. First is feather edge. These are also called as shoulderless crown preparation. And the advantage is conservation of tooth structure. But they should be avoided because they will not provide adequate bulk at the margins. Yes, obviously it is conservative design, but what will happen if tooth preparation is less? It will result in over-contoured restoration. And when we are making wax pattern, it will be difficult to handle also while fabricating wax pattern. So it is not recommended. Same as that chisel edge, it is also the same. It is a variation of feather edge. It is also not acceptable. This is bevel. Bevel is indicated when there is a ledge already exists due to dental caries, cervical erosion, or if there is any previous restoration. In such cases, we can use a bevel. What are the objectives of using a bevel? If the restoration which you are providing will be able to bend or can be burnished against the tooth structure if you are giving a bevel. Thereby, we can increase the marginal adaptation. That is one objective of doing a bevel. Second objective is to minimize marginal discrepancy because we are providing a proper marginal adaptation. Thereby, we can reduce the marginal discrepancy. And third objective is to protect the unprepared tooth from chipping. These are the objectives of giving a bevel. But the disadvantage is it extends preparation into the sulcus. It is indicated in facial margins of maxillary partial coverage restoration, inlays and onlays. Chamfer. Chamfer margin is particularly suitable for cast metal restoration, cast metal crowns. It is distinct and easily identified. It is made by using a tapered diamond burr with rounded tip. The most suitable instrument for making this type of finish line is tapered diamond burr with round tip. Advantages include distinct margin, adequate bulk, and easier to control. This is a conservative design when conservative finish line when compared to shoulder. Disadvantages: unsupported lip of enamel. It is indicated in cast metal restoration, lingual margin of metal ceramic crowns. Next is shoulder. Here, surface angle is 90 degrees. That is, more tooth surface is removed here. The burr used is flattened tapered diamond burr. Advantages: bulk of the material. Disadvantages: it is less conservative. It is indicated in facial margins of metal ceramic crowns or all ceramic crowns. Sloped shoulder. It is a modification of classic shoulder. That is, finish line is characterized by a 120-degree angle as compared to classic shoulder, which was 90 degree. Here, sloped shoulder, it is 120 degree. Advantages include bulk of the material and reduced unsupported enamel. Disadvantage is same as that of classic shoulder, less conservative. It is indicated in the facial margin of metal ceramic crown. Now, shoulder with bevel. I have already said the advantages of using a bevel. Bulk of material removes unsupported enamel. Disadvantages include less conservative, extends preparation, subgingival. It is indicated in facial margin of metal ceramic crown. That's all about the axial reduction. Now moving to the occlusal concentration. It is before starting a procedure, we should analyze the tooth with pre-operative radiographs. If possible, whenever possible, do a diagnostic preparation in cast and do a waxing procedure to know how much amount of tooth should be reduced, to know about how much occlusal clearance can be given. In this picture, you can see the supraerupted tooth opposing a long-term edentulous edentullousness in mandibular arch. In such case, what we have to do is we should correct the occlusal plane first, because there is a protrusive, there is a chance of protrusive interference due to this supraeruption. So in that case, we should not strictly adherent to the principle of conservation of tooth structure, because we have to correct the occlusal plane. For that, we have to reduce the tooth more. After doing a intentional RCT, we have to reduce the tooth and correct the occlusion first and give a restoration with proper guidance. Next is prevention of tooth fracture. Fracture can be lessened if the tooth preparation is designed to minimize potentially destructive stresses. That is, cuspal fracture should be prevented by proper cusp capping. To summarize, biologic considerations include prevention of damage during tooth preparation. Damage could be hard tissue damage or soft tissue damage. There are different ways to prevent it. I have already discussed about it. Next is conservation of tooth structure. There are certain guidelines to be followed. Next is considerations affecting future dental health, which include axial reduction, marginal placement, marginal adaptation, marginal geometry. All these things we have to consider. Next is occlusal consideration also. We have to follow certain guidelines. That's all about biologic consideration. That's the end of today's video. We'll be discussing about mechanical consideration in next video. Thank you for your patient listening. Thank you.